This COP is the first time in 30 years that we are talking about public health, and health equity need to be at the center of all climate solutions. And I'll give you a couple of examples. Let's take transportation, for example. Usually cities are designed to get you from point A to point B in the fastest possible way, and that ends up being a car-based system. However, if we think about health equity and think of what's the healthiest way to move ourselves and what is the way in which we can get mobility access to everybody, then we know that we have to have active transportation that is biking and walking, which has health benefits. We need mass public transit that is safe and accessible and affordable. And we also need EVs. This system not only keeps us healthy, but also helps us not replicate the errors of the car-based system and have impacts on responsible mining. Throughout the COP negotiations, you'll be hearing the term unabated emissions. This is where fossil fuel companies tell us that they can just suck out the carbon out of fossil fuels and voila, you have carbon-free petroleum, and that will solve all our climate problems. However, much like the filtered cigarette that the tobacco industry tried to sell us decades ago, fossil fuels, even when we take off the carbon, if that's possible, are still very injurious to our health and have disproportionate health impacts to communities of color and low-income communities. But right from the time we drill or mine for coal, those have impacts. So babies born near fracking wells have are usually born premature, and they have a higher chance of low birth weight. Kids who grow up near fracking wells have asthma. Elderly suffer from heart failure. And the same goes for coal workers and petroleum workers who work in these toxic industries and suffer the health impacts and pay the human cost of fossil fuels. So we need to move away from false solutions, and we need a full fossil fuel phase out.